Hello everyone! Today we'll be introducing the NTD intro series Worms, Worms, Worms. In this video, we'll explore three types of NTDs: soil-transmitted helminthiasis, schistosomiasis, and foodborne trematode. We'll be covering general information on each, including definitions, symptoms, medical treatments, prevention methods, prevalence, and global efforts to combat these diseases. Firstly, let's start with soil-transmitted helminthiasis. Soil-transmitted helminthiasis, abbreviated as STH, represent a group of intestinal worms that infect individuals through contact with contaminated soil. Three primary types of intestinal worms include roundworms, whipworms, and hookworms. Transmission of these parasites is chiefly facilitated through the dispersion of their eggs in the feces of infected individuals. This occurs when infected persons defecate outdoors or when their feces are utilized as fertilizer. In terms of infection routes, roundworms and whipworms can be contracted through contact with contaminated hands, fingers, or the consumption of improperly prepared vegetables and fruits. The eggs of these worms, present in the soil, can easily be transferred to the hands during various activities, leading to subsequent ingestion. On the other hand, hookworm infection primarily occurs through the act of walking barefoot on soil contaminated with the larvae of these parasites. The manifestation of STH symptoms varies depending on the severity of the infection. In mild cases, individuals may experience no significant symptoms. However, as infections become more pronounced, a range of symptoms may emerge. Heavier infections typically give rise to manifestations including diarrhea, abdominal pain, malnutrition, and more. Moreover, the impact extends to impaired growth and physical development, particularly in prolonged or severe instances. In the most severe cases, where the infection reaches a critical stage, there is a heightened risk of complications such as intestinal obstruction. In such dire situations, surgical intervention becomes a necessity. Diagnosing STH infections involves meticulous examination of fecal or GI specimens to detect the presence of eggs, larvae, or adult worms. Such examinations focus on assessing various aspects of the specimens, including color, consistency, and the presence of worms or segments, as well as the occurrence of pus or blood. Once diagnosed, the World Health Organization recommends the use of albendazole and mebendazole as effective, affordable, and easily administered medications. These recommended medicines have undergone extensive safety testing, ensuring their suitability for widespread use. Notably, their administration extends beyond traditional healthcare settings, with non medical personnel, such as teachers, being capable of providing these treatments. Both albendazole and mebendazole are donated to national health ministries in endemic countries. This donation initiative is specifically targeted at treating all school-age children, acknowledging the vulnerability of this demographic. Vulnerable populations prone to STH infections encompass diverse groups, including preschool and school-age children, women of reproductive age, and adults engaged in specific high-risk occupations like tea pickers or miners. To tackle the prevalence of these infections, the World Health Organization advocates a comprehensive control strategy. This involves the implementation of periodic treatment, commonly known as deworming or preventive chemotherapy, for at-risk individuals within endemic areas. Notably, treatment is administered without the need for prior individual diagnosis, aiming to mitigate morbidity by effectively reducing the overall worm burden. In conjunction with preventive chemotherapy, the control strategy incorporates additional measures to further curb the spread of STH. Health and hygiene education assume a pivotal role, emphasizing the promotion of healthy behaviors to diminish transmission and reinfection risks. Additionally, recognizing the importance of sanitation and disease prevention, efforts are made to provide adequate sanitation facilities. However, it is acknowledged that achieving this goal may pose challenges, particularly in resource poor settings. The global burden of STH infections is staggering, with roundworms, whipworms, and hookworm infections collectively impacting millions of individuals worldwide. These infections do not affect all populations equally, rather, they disproportionately burden the most impoverished and deprived communities worldwide. Areas with limited access to clean water, adequate sanitation, and proper hygiene practices are particularly susceptible to high prevalence rates. Geographically, the distribution of STH infections reflects a pattern of highest prevalence in tropical and subtropical regions. Regions such as sub Saharan Africa, China, South America, and various parts of Asia exhibit notably elevated infection rates. In order to prevent STH infections, the WHO is working towards achieving its global targets. These include the aim to achieve and sustain the elimination of STH morbidity in preschool and school age children, reducing the required preventive chemotherapy tablets, and augmenting domestic financial support for STH prevention. The initiative extends to establishing efficient control programs for SDH in various groups. Crucially, the strategy encompasses universal access to basic sanitation and hygiene in STH endemic areas by 2030. The WHO also collaborates with member states and partners to ensure effective preventive chemotherapy coverage for at risk groups, measuring intervention impact in countries with over 5 years of program implementation. Next, we will move on to schistosomiasis. Schistosomiasis is an acute and chronic parasitic disease caused by blood flukes. The transmission of this disease takes place when individuals come into contact with freshwater sources containing larval forms of the parasite released by freshwater snails. The infection occurs through the penetration of the skin during such contact, leading to the introduction of the parasite into the human host. Furthermore, the transmission cycle is perpetuated when the individuals affected by schistosomiasis contaminate freshwater reservoirs with their feces or urine, which contain parasite eggs. In water, these eggs hatch, amplifying the cycle of transmission and contributing to the persistent and widespread nature of schistosomiasis in affected regions. Intestinal schistosomiasis manifests with a spectrum of symptoms including abdominal pain, diarrhea, and the presence of blood in the stool. In more advanced cases, the impact extends to notable complications such as liver enlargement, hypertension, and spleen enlargement. On the other hand, urogenital schistosomiasis presents with symptoms like hematuria and, in advanced stages, kidney damage. Additionally, as the disease progresses, the potential for severe complications becomes evident, with bladder cancer emerging as a significant concern in later stages of urogenital schistosomiasis. Diagnosing urogenital schistosomiasis involves employing a filtration technique utilizing nylon, paper, or polycarbonate filters. The microscopic detection of blood in the urine of children infected with S. hematobium, a type of blood fluke, is facilitated through the use of chemical reading strips. Conversely, diagnosing intestinal schistosomiasis entails the identification of eggs in fecal specimens utilizing the catocase technique. In areas with S. manasoni transmission, another type of blood fluke, the circulating cathodic antigen or CCA test is a valuable diagnostic tool. For both forms of schistosomiasis, the recommended treatment is praziquantel, known for its effectiveness, safety, and cost effectiveness. While reinfection remains a possibility, initiating and repeating treatment during childhood significantly reduces and even reverses the risk of developing severe disease. A comprehensive array of control measures is instrumental in combating schistosomiasis. These include large-scale treatment initiatives targeted at risk population groups, ensuring access to safe water sources, implementing improved sanitation practices, and fostering hygiene education alongside behavior change. Additionally, the strategy incorporates snail control and environmental management to curtail the transmission cycle. The World Health Organization underscores a strategic approach for schistosomiasis control, emphasizing the reduction of the disease burden through periodic targeted treatment utilizing praziquantel. Schistosomiasis is highly prevalent in tropical and subtropical regions with a significant impact on impoverished countries that often lack access to safe drinking water and adequate sanitation. The geographical distribution of this parasitic disease is most pronounced in Africa, where over 90% of individuals requiring treatment for schistosomiasis reside. The affected populations are predominantly found in impoverished rural communities, with a notable concentration among agricultural and fishing populations. In a concerted global effort, The World Health Organization spearheads the coordination of a comprehensive preventive chemotherapy strategy through extensive collaboration with partnering entities. These collaborators encompass a diverse range, including academic and research institutions, the private sector, NGOs, and more. To fortify the strategy's implementation, the WHO takes a proactive role in developing technical guidelines and tools, providing crucial support for national control programs. Moreover, the organization actively engages in advocacy efforts alongside partners in the private sector to enhance access to praziquantel, the recommended treatment for schistosomiasis. This collective advocacy also aims to secure the necessary resources for effective program implementation. Notably, significant pledges of praziquantel from the private sector and development partners have been secured, amounting to a quantity sufficient for treating over 100 million school-aged children annually. Lastly, we will discuss foodborne trematode. Foodborne trematodes constitute a group of diseases characterized by parasitic flatworms within the class Trematoda. These intricate parasites, known as flukes, engage in a complex life cycle involving various definitive hosts and one or two intermediate hosts. Notable types within this category include Conorchis, Opistorchis, Fasciola, and Paragonimus. Infection primarily occurs through two key routes: the consumption of contaminated food, involving the ingestion of raw or undercooked freshwater fish, crustaceans, or aquatic plants hosting the larvae of foodborne trematodes, and the direct consumption of contaminated water containing infective larvae. Common symptoms of light infections with foodborne trematodes often present a clinical spectrum ranging from asymptomatic cases to manifestations such as fever, nausea, swollen liver, skin rashes, and abdominal pain. In instances of chronic infections, the health impact becomes more pronounced, with symptoms including anemia and an increased risk of bile duct cancer. Diagnostic methods for foodborne trematodes employ parasitological and immunological techniques. Parasitological techniques involve the detection of eggs in stool samples, specifically for Clonorchis, Opistorchis, and Fasciolosis. In contrast, immunological techniques detect parasite-specific antibodies or antigens in serum or stool samples, offering higher sensitivity, although they cannot distinguish between current, recent, and past infections. Guidelines for treatment vary depending on the specific infection. For Clonorchis and Opistorchis, praziquantel is the recommended treatment. In cases of fasciolis, triclobendazole is the preferred therapeutic option. For Paragonimus, both triclobendazole and praziquantel are recommended, with triclobendazole being preferred due to its simplicity and higher compliance. Effective control interventions for foodborne trematodes encompass a multifaceted approach. Initiatives include widespread dissemination of information, education, and communication on safe food practices, emphasizing the importance of adopting hygienic habits. Moreover, interventions extend to improving sanitation facilities and implementing veterinary public health measures to break the transmission cycle. In alignment with the World Health Organization's recommendations, public health control strategies involve community diagnosis at the district level. Population-based preventive chemotherapy is strategically implemented in areas with a high prevalence of infections, aimed to curb transmission on a larger scale. For cases where infections are less clustered, individual case management becomes a crucial facet of control. This approach is particularly viable where health facilities are readily available, allowing for targeted interventions tailored to the specific needs of affected individuals. The combination of community-wide preventive measures and individual case management underscores a comprehensive strategy to combat foodborne trematodes, addressing both the broader context of transmission and the specific needs of infected individuals. The prevalence of Clonorchis and Opistorchis is predominantly concentrated in Asia, with many countries in the region being endemic for these diseases. Certain villages in the Lao People's Democratic Republic exhibit hyperendemicity, recording Opistorchis prevalences exceeding 80%. Paragonimus, on the other hand, spans regions in Africa, Asia, and Latin America, and in some areas it coexists with tuberculosis, leading to potential challenges in accurate diagnosis and treatment, thereby contributing to underreporting. Fasciolosis emerges as a global disease affecting numerous countries worldwide. Latin America and Middle East, in particular, report high burdens of this parasitic infection. Global efforts to combat foodborne trematodes are fortified through collaborative initiatives with partner agencies including the World Organization for Animal Health and the Food and Agriculture Organization. Facilitated by tripartite joint meetings, these interdisciplinary collaborations aim to synergize expertise and resources, supporting countries in enhancing capacities for effective control measures. In a strategic move towards integration, the World Health Organization advocates the harmonization of foodborne trematode surveillance and interventions for water, sanitation, and hygiene programs. This collaboration approach extends to the joint delivery of preventive chemotherapy, strategically integrating with initiatives such as food delivery or immunization programs. This synergy not only optimizes resource utilization but also enhances the overall impact of interventions on affected populations. Recognizing the interconnected nature of diseases, joint efforts in surveillance and diagnosis are paramount. The collaborative detection of paragonomus and tuberculosis serves to improve surveillance mechanisms, ensuring accurate diagnosis and timely treatment of cases. Thank you for listening. If you have any questions, feel free to comment on this video.